Whichever way you look at it, whether you're looking at the Congressional Budget Office enrollment projection of 13 million people enrolled by the end of 2015, or the Health and Human Services Department projection of about 9.9 million people enrolled, the majority of those people are going to have to be people who are currently enrolled and renewing their coverage. So while it's important for the marketplaces to reach out to the remaining uninsured, they also have to really focus on getting people renewed.
Yeah, I think that's right. And, the challenge is you want people to take advantage of the opportunity to renew their existing coverage and continue it on for another year. And the extent that you can do that with some kind of automatic mechanism, that helps make that process go more smoothly. At the same time, there's a risk if people end up enrolling in a plan that isn't the best plan for them. We do have some experience in the Medicare program, as well as in private insurance. I mean, most of us in our own insurance and most Medicare beneficiaries automatically renew their coverage from one year to the next without taking any action. And in the Medicare Part D program, it's the case that is the way it works, and people are automatically continued in their existing coverage if they take no action at all. But one of the factors that leads to is that nearly everybody in Medicare Part D stays in the same plan from one year to the next, even in situations where it might be to their advantage to switch to a different plan.
I think one thing that was really interesting, Jack, that we found in this study is that many of the state-based marketplaces appear to be taking advantage of some of their flexibility under federal rules to try to improve the consumer experience, and perhaps most importantly, make sure that people are getting the most accurate tax subsidy possible to try to make their coverage more affordable, or to help prevent them from facing potential tax liability down the road. And what we heard and saw in the marketplaces that we talked to was that there was a real intense focus on making sure that the consumer understood what they were supposed to do and when they were supposed to do it. And I think importantly, unlike what will happen for consumers who are auto-enrolled through the federally facilitated marketplace, where they will get the same exact dollar amount in subsidy that they were getting in 2014, these state-based marketplaces that we spoke to, 4 of the 6, are going to be able to adjust people's premium tax credit to reflect some of the changes that are taking place in plans and premiums as people transition from 2014 to 2015.
And that's clearly a real advantage for those people to make sure that their tax subsidy, their tax credit that they're eligible for is going to be accurate, and it makes sure they get the best benefit out of that.